Hi, my name is Bree. I'm a student nurse here at UK. I have Miss Emily Johnson. It is 7:30 a.m. Emily Johnson is a 76-year-old female from Pikeville, Kentucky. She is a grandmother of 6 and works part-time at the local library. She has type 1 diabetes and a yeast infection. Emily also needs a flu shot for the season. On assessment, the nurse can pinch more than 2 inches. See healthcare provider orders. All right. Emily Johnson, date of birth 12/16 XXX, MR number 361806612, age 76, height 60 inches, weight 68 kilograms. Drug allergies, morphine and codeine. Diagnosis, type 1 diabetes and yeast infection. Today, at 1300, Miss Emily Johnson will be receiving quadrivalent inactivated influenza vaccine, Fluzone, 0.5 milliliters IM right now, given in the deltoid site. She's also going to be receiving 10 units of human recombinant Humulin N sub-Q daily. And then she's also going to be given Myconazole, Monistat 3, 1 application vaginally 3 times a day. All right. So I am going to begin by So first I am going to check my MAR against my order. So if we look here, we can see Emily Johnson, MR numbers 361806612, matching date of birth 12/16, XXX matching, drug allergies, morphine and codeine matching, and then here we're going to move on to quadrivalent inactivated influenza vaccine, Fluzone, 0.5 milliliters. I am now at 7:30. Human recombinant Humulin N sub-Q daily, 10 units. Here, same recombinant Humulin N, 10 units sub-Q daily. And Myconazole, Monistat 3, 1 application vaginally 3 times a day. And the same here, Myconazole, Monistat 3, 1 application vaginally 3 times a day. Okay, so our MAR and our orders are consistent. So now I'm going to head over to the Pyxis. I'm in the Pyxis and I am just going to grab my medications. I am going to first acknowledge, I guess I'll call my phones. So I'll grab my medications. First, we're going to look for the Fluzone. Fluzone, here we are. And then Humulin N. There we are, and that's her insulin. And then here we're going to have our Myconazole, Monistat 3. This is going to be the applicator. I'm not going to show her on her how to put this in, but I will demonstrate. Here we are, and that is what we are looking for here. They match. I am going to now go over here, and she does have a few drug allergies. I would make sure that the influenza recombinant human recombinant Humulin N and the Monistat 3 had no contraindications with the morphine and codeine allergy that she has. I would also come in here if I had any questions about what any of these medications would have, and I would look at indications it would do to her or a reason why she would need to be taking these if I had any questions. Okay, so now I'm gonna start doing my first med math check. And she is to be given Fluzone 0.5 milliliters. Okay, so 1 dose, 0.5. It goes all right. So 0.5 milliliters is to be given to her, and then no, we don't need to do med math for her insulin or her miconazole. Her insulin is 10 units because she has type 1 diabetes. Typically with type 2 diabetes, we would be taking blood sugar, but because hers is type 1, we just know it's 10 units based on the order. Okay, now I am going to move over here to my quiet space. Do my med math check one more time. So 0.5 milliliters, 1 dose. 5 milliliters. Okay, for the Fluzone. Perfect. Okay. Now that we've done our med check, I'm going to begin getting my medications ready for to administer. So I'm going to start by marking my meds and labeling them. Okay, so we have Fluzone. IM 0.5 milliliters. 0.5 milliliters for E. Johnson. My initials are BS. 0730. All right. And then Evelyn N. 10 units for E. Johnson at 0730, and my initials are BS. And then my last one is just going to be for the miconazole. Is that 3? 1 application for E. Johnson. 0730, and my initials are BS. Okay. Okay, now that we have our labels prepared, we're going to go ahead and start getting our medications ready to be administered. I'm going to start by washing my hands. All right, so I am gloved and my hands are washed. We're gonna start with, we'll just start at the top. We'll start with the Fluzone, 0.5 milliliters IM. So for 0.5 milliliters, we're gonna grab a small syringe. There we go. A 1 milliliter syringe with a 23 gauge. Here we are. And then for our insulin, we'll just grab an insulin needle. And then we have what we need here for this. Let's start with getting this together. Oops, that didn't work out. here.
And that's to be given now for this. So I've got Mercury, General, and Milligrams, and Muscular every 4 hours after the pain giving the central gluteal site throughout matches.
Oh,
And I'm gonna give the first dose.
okay, so we have a 1 milliliter syringe with a 23 gauge needle to administer our Fluzone, 0.5 milliliters. So I'm going to draw back 0.5, maybe a little bit more, give me a little space. Okay, and I am going to open this up. This here, we're going to inject the air. And now we're going to draw up the medication, being sure to make sure the needle is below the medication, just because we don't want to pull up air. I'm going to draw back 0.5.
So I would be giving 4 units.
Make sure I'm getting enough. All right. So knock out the air bubbles. And I am also going to make sure my medication is the right. There we go. We have 0.5 milliliters here. No air bubbles. We've knocked them out. Perfect. So now what we're going to do is a one-handed recap. Put this here just so we don't stick ourselves. And this is ready. So this is our Fluzone. Miss Emily Johnson. Next, we're going to move on to the insulin. This kind of fell off, so let's do this. This can go back and fix this. All right. So, same thing, we're gonna do 10 units for Miss Emily Johnson. So I need to pull back to 10 units worth of air. I give it a little bit of room. And now I'm going to inject my needle into here, push my air in, and draw back 10 units. There are no air bubbles. I'm gonna have Nurse Jackie double check that this is 10 units.
10 units is confirmed.
Okay, perfect. So once again, we are going to one-handed recap this. So we are ready to administer it to Ms. Emily Johnson. And then I will administer this at the bedside just because we're going to explain it to her. But I will put this on here for her. All right. Now I have her medications ready to go, labeled. Everything goes back into the Pyxis. And now I'm going to gather some supplies. We're going to give a couple shots. So I'm going to grab some gauzes, maybe a band-aid, you'll never know. Definitely alcohol swabs. And we are good to go. Walk over here. Knock, knock, knock. Hi, Miss Johnson. It's Bree. I'm your student nurse today. I'm going to be giving you some medications. Could I ask for your date of birth and your name and date of birth? Emily Johnson. Oh, sorry. Try this. All right, Miss Emily Johnson. Date of birth 12/16/XXX. Perfect. Okay, Miss Johnson, looks like you have morphine and codeine allergies, is that correct? Yeah, okay, and what happens when you take morphine and codeine? Oh, you get itchy? Okay, so not anything too crazy, you don't have any anaphylactic shock or an anaphylactic shock? Okay, we
I'm going to.
ran through the drug book and made sure there was no contraindications for what you're gonna take today, and make sure that you didn't have any reactions and that everything you're taking today doesn't react with each other in a negative way.
Okay.
Okay.
For my.
All right, we're gonna go ahead and get started. So we are going to start with
This is the.
your
Intramuscular
influenza vaccine.
Find the correct. So I'm gonna use this 23 gauge, and it's a 1-inch needle.
So let me start by washing my hands and putting on some gloves.
Perfect. I need to draw up my, Hyperion. I like to use the blunt needle to draw that up, and then I'll replace it with the needle I'm going to use. I'm gonna get a syringe that I need, which I probably
Okay.
go on and do my med mask. and
So
make sure I get
we
the
are
correct
doing
size.
your IM today
I only see 3
in
milliliters.
the
So I'll go ahead and grab that, and I'll change it out.
deltoid.
I'll lay a Band-Aid.
So Ms. Johnson,
Maybe 2.
your deltoid,
I'll need some tape so
We're
that I
going
can label my
to
medications after I get them ready.
begin by cleaning the area.
Alright, I think that's all I'm gonna need. So, I'm going to go ahead
So we're gonna do
and
combing process
go to my
here.
quiet station and get this ready. So, here. I'm gonna.
Outward circles,
I'm just gonna
big
look at
circles,
that
leave
first,
that there
and
so
then
I have a
I'll-
marker.
and
And I am gonna go in at a 90-degree angle. All right, on the count of 3, all right. 1, 2, 3.
First,
I'm gonna
I wanna,
administer somewhat slowly.
Alright, so for my insulin, the total volume here is 100 units. I know
All
my
right.
sugar is 144.
There we are.
And according to my sliding scale, that
Okay.
would be within 4 units of.
That was 1. Now we're gonna go ahead and give your insulin. There's no bleeding, so I'm not gonna give you a Band-Aid. I'm gonna go ahead and assess your belly, make sure that there's no reason we can't give it to you in your belly today. All right, perfect. You ever had any pain or discomfort down there? No. Good, good, good.
I do not, I'm sorry, for my.
Okay, so this injection is gonna go right in your belly. I'm sure you've done it a million times. I'm just gonna go ahead and pinch up a little and give you some insulin, all right?
But if I did, I would be doing that now.
All right. Count of 3. 1, 2, 3.
So what was ordered is 10 milligrams.
All right, perfect. No bleeding either. Good to know. Gonna go ahead and on hand recap that, and this goes right into waste. And then lastly, we're gonna go ahead and do give you your monostat. So your monostat is given vaginally. I'm gonna let you do it. I'm gonna help you fill the tube and show you how to administer it. So the best way to deal with this is to kind of use it like a tampon. I'm sure you're familiar with that. So you're gonna go ahead and start by filling the tube with monostat all the way to the top. All right, make sure your hands are clean, obviously. Practice good hygiene. Once you are, your tube is ready and prepped, you need to, I think it's best if you're sitting down. Some people prefer to stand, it's just kind of based on your comfort level. Once you sit down, you're gonna squat with your legs kind of like a plie. If needed, I'm not sure where you're at, there is some lubricant here if you feel like it would just be easier this way. But if not, you go ahead and administer this into your vagina, and you push up slowly, making sure to get all the product out, and then you can remove this and you're good to go. You're gonna need to do that 3 times a day. It can be messy. I would recommend wearing a panty liner of some sort, just because it's gonna be cleaning out and making sure that disinfection goes away. Do you have any questions?
Okay,
No?
so
Okay.
promethazine.
Perfect. All right.
Okay. This is an
I'll
anti,
go ahead and cover you back up.
which makes sense because this patient has nausea.
All
So I'm giving
right.
this to treat nausea.
Is there anything else I can get for
It
you?
is a suppository.
No? Okay.
Okay.
Well,
So
thank you, Ms.
the,
Johnson.
dose is
You are all good to
21
go.
daily
I'll come back and
as
check on you in a few minutes, make sure you don't have any complications with your medications that we just gave. I'm here as your vaginal suppository and some lube if you need. Please call me if you need anything. There is your call lights, and I think you're done. Okay.
Good.